image when we look at a spine. But when we look at a spine, we always want to look at it in different angles and multiple slices, okay? This image only looks at fluid flow along the spine and in the body.
Okay.
So that tiny piece there, that's the bladder, and it's normal to be very white and round because it's filled with urine. And right now we're looking basically at pistachio from the side. And here we have a cat, so that's good.
Yeah.
So basically the shoulders are up there, and then the tail is up here, so that tiny piece there. So what I'm expecting is a nice basically band like this that shows my fluid, because we know that there's fluid around the spinal cord, fluid and fat, okay? And when we see here is that there's something going on there. You see that probably, right?
Okay, it's supposed to still be straight.
Yeah, and if you don't mind, I'll just show you a,
Yeah.
well, more normal spine, if you don't mind 2 seconds. You'll have to forget the names.
Don't worry. We're both in healthcare. We don't.
Yeah, and this is basically a dog. It's not quite a normal spine, but it's actually,
More than.
yeah. So you'll see the shape. So that's the image I was showing you, basically.
Oh,
So it's very straight. This dog had a different kind of issue. He had a disc compression there. But just so that you can see kind of the shape of that first image, because I find it's the easiest image to understand, basically. So that's the most detailed one. Again, a slice in the middle looking from the side. And the spine is all of that, okay? So with my vertebrae. And then my spinal cord is the gray line in the middle, okay? So it's relatively straight, right? So let's go back to pistachio. So here we have a bump there, okay? And so what I want to know basically when I see that is, with my most detailed images, then I want to know what's happening to that spinal cord, really. So let's take it one at a time.
What a good picture.
Yeah, that's why we always say the MRI is really our most detailed modality, much more than a CT scan, because a CT scan is like looking in black and white, and this is fully HD.
Wow.
So again, that's my spine, okay? So with my vertebrae there, the tail is here, so that spot there, and then the base of the neck is there, okay? So here we recognize our pointy bits there, our spinous process, which are there, okay? So we're looking at basically this area of the body, and we can start seeing a bump there, okay? And you can probably start seeing that these spots are a bit different color than this spot, for example, okay? And this particular image is what we call a T2 weighted image. It means that two things only should be white, fat and fluid. So we know that those little discs, which are underneath here, they're supposed to be very fluid filled in the middle. So they have to have their little dot that's very white. And then here in this one, this one, this one, this one, this one, we have lost our white content. But sometimes that's just a normal aging process. And that's very common in dogs and in humans. We'll just lose our fluid center just with aging, wearing out of those discs. But what we see as well is a little bump there, a little black bump there, interrupting my white line underneath there. You probably see that. And just the shape of that looks weird from the start. So now we want to know, in that view, what does it do to the spinal cord? Because that's the answer that we're always trying to find, basically, is what's happening to the spinal cord, because that's how we decide if it's medical or surgical. Because if it's something that's compressing the spinal cord, then often our options to reverse that is removing the compression, okay? Now there's another detail that I haven't mentioned to you over the phone, because I thought it would be easier to just explain in person, but basically, again, what I want to know is what's happening to that spinal cord. So this is the top of pistachio, so that's the skin, so we know we have fat in the skin, so that's why it's so white. And I'm basically looking at that.
Like that, okay.
So top of the vertebrae, and I can make it a little bit more clear. Top of the vertebrae, that nice and round structure in the middle, which is gray, is my spinal cord. Okay, so that yellow bit. And then underneath here is my
The body.
bone, and if I go on top, oops, of just there, that's disc. That's the disc in between. Okay.
Okay.
And then what it allows us to do is basically when I pass through there, you'll see that the shape of the spinal cord itself will change, and it's not going to be nice as nice and round, if that makes sense. So when I passed higher up, also we can start seeing that the bone around is kind of tilted.
Wiggling.
So this here, this is where there's the most compression, that makes sense, because we can now see that my spinal cord is just that area there, and it's more oval shaped. It's not as
round.
Oops, I'll go back. Exactly. It's not as nice and round there, okay? And we know that often in dogs or even in cats, but a little bit older cats than what he is right now, we can have pure disc compression. So issues with the disc where that little white center, the little gem in the middle just pops out and go compress the spinal cord. But it's very rare in young animal like pistachio. And here we see that the shape of the bone around is not perfect.
Yeah.
So that's more because of that that we have a compression, if that makes sense. Because if this is mal-shaped, then it can put a little bit more pressure on that disc, and that can cause a little bit of a bulging as well. Okay, but the other thing that we're gonna do though, and I'll come with the options in a second, but I just wanted to show you all that area basically of the spinal cord is not as nice and round, and we can see
Oh yeah.
here is the most compressed one, really, and we can also see that in the middle, the color itself. So if you look at this bit and then that bit, that there is a tiny bit more white. That can be from the compression, a little bit of swelling.
Okay.
If that makes sense. Okay.
Is that where you would have thought the pain was?
Yeah, exactly. So that is right around here, really, and that's where he was kind of
Wiggly.
looking and what are you doing? And that again, this spot explains perfectly why those back legs, the signal is not perfect. Okay, so now that we see that, and because we have abnormally shaped bone, what can cause abnormal shaped bone? Well, in a young animal, we always think about malformation. He was just made like that.
He was the runt too. I
Right.
thought.
Right. But just because of that bit of irregular look there, we're just going to cover him with antibiotics, just in case there's also a little bit of bacteria that's remodeling the bone as well. Okay. And I think it's a pure malformation, but we just want to cover
Make sure.
exactly that basis, because looking at that, the best way to basically prevent progression of the signs would be to go surgically, and then we would be doing two things basically. On let me go back there. So on this side, which is the left side, which is the side he was a bit worse to me on exam as well. So that side we would go basically approach from the top of his back and uncover that bit of muscle to get access to that. And then we would go basically make a little window in the bone to go decompress with that bulging of the disc, decompress on that side, okay? But because we have a weirdly shaped vertebrae as well, we would want to stabilize those vertebrae, so
Okay.
fuse them with implants in a more straight position to kind of prevent basically the
From it
further
to-
bending and further compressing of the spinal cord. Because the issue that we have, knowing now that we have something compressive, is what if we do nothing, and what if it gets worse? What could happen is basically exactly lose usage of his limbs, but the last thing we lose is really the deep sensation, so the deep feeling when we pinch the toes. If we don't feel the toes, then that's really where we're basically the last stage of spinal cord injuries. As long as we have the deep feeling in the toes, even for example, if we do surgery on a dog that can't use his legs, but he feels those legs, then we know that we have good odds of success. Okay. Now, in his scenario, because we are, we know that we have some malformation, and as much as we put it more straight, will he ever go back to walking absolutely normally? Not sure. He might keep some deficits. We usually are at our best 2 to 3 months after surgery. The goal of surgery in his case would be to improve comfort, because that's causing discomfort, and basically slow the progression of the signs so that he doesn't lose usage of his legs, basically. And the other risk when we do fusions of a few vertebrae is that sometimes we can have issues with the space below or higher. Does that make sense? Because it puts a bit more pressure on those two sites. But looking at that, it would really be the best way to do something about that. If that makes sense. I realize though that you'll need to discuss it for sure. And it's a procedure that we say usually we have good odds of success because he feels those legs. How normal are we going to be? I'm not sure. Could he have a recurrence? Technically, is the recurrence rate high? No. But it's possible because we basically fuse those vertebrae. We don't know in the long term how frequent is the recurrence rate when we fuse. We know in the studies out there, if we have an issue with purely just the disc, we know 15%, so 15% of the cases can have a recurrence issue in the future, because we know they have discs all along the spine. In his case, it would be more, if we fuse that, does it put more pressure on the disc on top and below? We don't have perfect studies in animals out there that look at basically long term. Let's say when he's 10-year-old, what's going to happen? We don't have that information. So my job is, again, to warn you that it could happen. But medically, the thing that would make the most sense to do would be to go decompress that spot and fuse it. Okay. I'll stop for a second because I know it's a lot.
Okay.
Does that make sense, the whole principle?
It does make sense, and seeing this does make me feel better about this. We were really worried it was FIP or something like that, right?